That is a bad law. I will be calling on the legislature to give local flexibility for towns that want to allow bars to be open to 4 in the morning or 6 in the morning or whatever they want to do. Nightlife is an important part of our culture. I think that as part of the recovery, towns that value nightlife economically, culturally, should not be encumbered by the state. And the state should not prevent them from being open till 4 in the morning or whatever they want. And likewise, other towns that value quiet communities or a downtown that doesn't run all night absolutely should have the flexibility to continue being closed at 2 or at midnight or whenever they want to require their local businesses to close. So along with this temporary measure, where statewide the last call for alcohol will be 10 o'clock, I want to call upon our Republican and Democratic friends in the legislature as part of the recovery when we're through this pandemic to give our communities the flexibility to have a vibrant, thriving nightlife at whatever hours that they choose to. And that might be the light at the end of the tunnel if you're in your 20s and are missing going out this summer and fall. We hope to have a new normal and with the cooperation and work with the legislature where there will be an even better nightlife in Colorado when we're through this pandemic. But for now, it's a short-term sacrifice to keep us safe, to keep our economy reopening, to protect our neighbors, protect our friends, protect yourself. Last call for alcohol, 12 p.m. And we value sobriety in public places. Doesn't mean people won't have drinks with dinner, but anybody who has been drunk just knows this inherently. Your best goals around social distancing and your best intents just fall by the wayside if you're in a group of 50 or 100 people where folks are inebriated. Inhibitions are reduced. I suppose that's part of the reason people drink, actually, is to reduce their inhibitions, sometimes around interacting with members of the opposite sex or the same sex. That's, I guess, a reason people do that. And that's fine. People do it for whatever reason, escaping reality, reducing inhibitions. But it is that very reduction of inhibitions that leads to the lapse in mask wearing and social distancing. And Colorado cannot afford that without risking a setback to our economy, a setback for kids returning to school, and of course the loss of life. And in the long run, I hope that we can work with the legislature to allow bars to serve even later, 4 in the morning, whatever local communities want, because last call at 10 is not a statement about the value of nightlife. It is an important part of our culture, an important part of our economy. It is simply a short-term public health necessity in our state because alcohol reduces inhibition, and when people are out late at night, we are seeing that spread in that 20 to 29 age group. And I know that's tough for people who want to get out and party, but this is not the summer to party. There will be a time to party when there's a vaccine or cure and we've licked this thing. There's going to be a big party that we're all going to be part of. And I hope that we can work to have a new normal that provides more freedom for businesses and individuals to stay open later if they choose, as well as local communities. Here's some data on the bars that helped lead to this decision. So bars are facilities that don't have full food menus. They have at least 5% of their business occurring after 10 p.m. In April and May, the bar traffic was reduced 80%. In June, bar traffic increased. We had about a 50% of the normal flow. And then in early July, and I think this is one of the reasons we've seen the spread come back, people have returned to this kind of socializing environment. Now, many serve food. Remember, we are getting at proxies here. We for a bar to be open, in many parts of our state, they can actually just be flat out open. But in the Denver metro area, they're serving food. But it's not the act of serving food that makes it safe. Food has no bearing on the safety. It's the social environment, meaning bars can absolutely be open. They can be open past 10 p.m., no issue. But they are functioning effectively as restaurants, meaning people can go in group of 4, group of 6. You're with the group you came in with. You're seated at a table, you're having fun, you're having drinks till 10 and food after 10, but you're not in a freewheeling social environment where you're interacting with hundreds of people. So there is a safe way to do business in this world. A number of responsible bars and restaurants are absolutely doing that, including into the late hours of the night. They will continue to. But it is the type of social environment that is this risk factor here, and we've seen that with the increase in late night traffic. Again, more dangerous if it's associated with alcohol. If people do want to go out for a meal at midnight and have a meal, that's totally fine. But as inhibitions are reduced and as those groups that came in together as 4 or 6 drift apart and interact with others, that is where we get this community spread that we are seeing the data on right now. So, the state will continue to make decisions based on how we can move forward with our economic reopening, how we can move forward with protecting public health, how we can partner with our public health departments at the county level, as Jill talked about. Smaller corrections like these, coupled with responsible behavior from Coloradans of all ages, but particularly here talking about 20 to 29, is what's going to make the difference. And look, there's no, this is the tough part here. While we have some impact on exactly what bars and restaurants are doing, we have less impact. It's up to you whether there are house parties. And that is a big part of that 20 to 29-year-old spread. Now is not the time for house parties. I mean, I know you want to do it. You've been cooped up. It's fun, but have 4 people over. Just have 4 of your besties over. It's not the time to have 80 or 100 people over. It'll go from 1 person to 30 or 40 people. And you know what? Even in that age range, 1 or 2 will probably wind up in the hospital. And then not even beyond that, the people of other ages that it spreads to. So let's have fun, safe way, responsibility. No one wants to be have to be mature beyond their age, but that's what the times call upon, and I know that the young people of Colorado and people of all ages in Colorado will live up to that responsibility and will shine, and that Colorado can stay an exception to these trends that we've seen in many of our neighboring states, and that we are worried about the early indications of here. Also want to share some good news. Kaiser Permanente has stepped up and added a generous contribution of $500,000 to the COVID Relief Fund, helpcoloradonow.org. I've been out and around the state visiting some of the grantees of helpcoloradonow.org. Community nonprofits. I was in Greeley and Fort Collins the other day that receive funds. I want to thank Kaiser, and I want to help all of the donors for helpcoloradonow.org. You can go to that website and donate too. The money goes right out the door to those in need. $300,000 of the Kaiser donation is helping with contact tracing, focusing on cultural competency around contact tracing. And there's another $200,000 through the employee donation program, thanking all of the employees of Kaiser that have done that. And if you work with an organization that needs emergency help, you can apply for these emergency relief funds at helpcoloradonow.org. That's emergency help for community nonprofits that can show that they can get that help right back out to the community. It could be rental assistance,